So today we're going to be exploring the SNS, which is Sistema Nacional de Saúde, so the National Public Health System. So one of our viewers posted a question regarding, can you talk about what's going on the national healthcare, the public one? Why do people wait for so long to have procedures? So today we're gonna deep dive on that. Why does this happen in Portugal? What are the reasons behind it? So stay tuned and let's go for it. So let's start by introducing the players on why is the national healthcare, public healthcare system in Portugal is sometimes in such a peril. When you look at the news, you see so many people waiting for procedures, you see hospitals in smaller cities closing, clinics closing. So let's see who are the main people involved here. So there's two main elements here that play together, sometimes not as well as we hoped. One of it, you have the government, and the government in Portugal is elected every 4 years. So they sometimes change. And on the other side, you have an institution that has been here for a really long time and it's much more stable, which is called Ordem dos Médicos. So the Ordem dos Médicos is basically the association that once you graduate from med school, certifies you as a practitioner, as a doctor. This institution is the one that controls how many openings exist in med school across the country. So how many universities have spots for students to go into med school. So they are the institution that is looking at all of this, that each specialization is doing what they're supposed to be doing, that they're following the right approach. So they have a lot of power, as you probably are already noticing. So they need to play together with the government. In order for the public healthcare system to work, you need doctors. And you need doctors to graduate, integrate the public system, and stay there. So the biggest issue right now is that a lot of doctors are leaving the public system. Either they go full private in Portugal, or either they simply leave the country. And on the other end, you have here the Ordem dos Médicos, this association that for the longest time has been, I don't know if capping is the right name, but it has been keeping the openings for studying to be a doctor at a very not as big number, because their statement is that in Portugal there is enough doctors. And their statement isn't wrong. There is, in theory, enough doctors, but the public system is not captivating them enough for them to stay. So as any person, they want to have a decent pay, a decent hour. So some of them move on. So those are some of the things. Another big element in consideration is that on the other side, you have the government pointing the finger at the Ordem of Médicos saying, you're the one that caused the problem because you don't let people in to be doctors. So in Portugal, for you to enter university and to be a doctor, you need to have really high grades. So in a scale of 0 to 20, many times they're asking you to have a 19 to be a doctor. So you can imagine how competitive it is to become a doctor in Portugal. So much that it has driven a lot of students that want to be doctors to study on our neighbor country, Spain, because there is much more accessible to go and be a doctor. You can go in with a 14, 15, you probably can make it. So you have some dynamics here, and they are not trivial. And there's a lot of finger pointing. The government points into the Ordem of Médicos. The Ordem of Médicos points at them and say, you are not providing good enough conditions to retain this talent. And we need to think as well that for you to have a doctor, a specialized doctor, let's pick a psychiatrist or obstetrician, they need around 15 years to be specialized and integrate fully the SNS. So there is a big time window. So there's two lines of thoughts here. There's some people that clearly point the finger towards the government. This is your fault. You didn't manage this well. You're not attracting people to stay. And other people will point the finger at the Ordem de Médicos, this association, and point the finger at saying to them that you've been very elitist, you kept the openings very low, letting only small percentage of people study to be doctors. So of course, and on top of that, 15 years. So 15 years ago, you should have been thinking about letting more people in. So there's many lines of thought depending of who you ask. Some people believe it's the government because often they change. So recently they were on the socialist side. It changed more to socialist, but more towards the center. And the government changes, all the ministers change. They need to go into the Ministry of Health, figure out how they're going to manage this crisis. So it's not trivial. And then there's real life stories that I want to walk you through, so you get a glimpse of why do people actually leave the public. So let's jump into that. So this is the best article I've read regarding what is the reason why do doctors leave. And it's a really harsh reality and actually made me really appreciate even more the doctors that decide to stay in the public system, because what is described by some of these folks is actually quite atrocious. So let's go and jump a little bit into this news. So the first story they tell is about this gentleman that is studying to be a doctor and a psychiatrist, and he basically gave up to do this specialization in Portugal because it was so many hours and so little pay that it was simply unbearable. So he decided to go and do his specialization in Germany. And he believes that coming back to Portugal will be a big step backwards, which is really, really sad, right? We are educating these doctors and we are unable to retain this talent. So it's painful. But when you look at the reality just here, like in Portugal, a doctor that is studying to be a specialist is making euros. And this is probably brut, so you still need to probably put taxes on it. It's not a lot of money. If you think about someone that's putting so many hours, that has such a stressful job, they're not working and they're studying, plus they have other people's lives in their responsibility. It's a huge demand from that person. And when you look at neighboring countries like Germany and you can make this amount, I mean, it's a no-brainer. You immediately start waiting, do you want to stay or do you want to leave? I mean, you're just human. Even if you want to give your best and help people, you have bills to pay, you have family, and you want to spend time with them. So that's one of them. And then they also interview another senior doctor that is probably on his 50s, that he's thinking about actually giving his resignation letter because he's in the public system and he is really frustrated. So here what it says is Manuel, he has his letter to resign signed, but in the drawer because he still thinks a lot about the patients that he is helping. And he just describes a situation that for me is just absolutely insane. So here in this paragraph, he says basically, just this is so insane, it's like literally. So he's a doctor that's doing biopsies and apparently is on the neck. So he needed needles a little bit bigger and he requested the administration and he had to put up a big case explaining why it was bigger so people wouldn't suffer. And it took around 1 year to grant them those needles. And those needles cost 70 euros. I mean, it feels like almost he'd be like, excuse me, patient, could you please bring this type of needle to the procedure just because to make things going a little bit faster. This type of bureaucracy is soul crushing. And I admire this practitioner to still be able to be there just for the patients. That's amazing. So these are some of the painful situations they go through. This is also a great article that describes why the government is unable to retain the doctors in the public system, because the public is so poorly managed that the private becomes really, really attractive. I mean, if you're in a system that you need to wait for so long to get a needle to help someone, it's absolutely insane. Why would you want to stay there? So that's what's happening. Then to pile on what for me is already soul crushing, to be a doctor in the public system, to have to work so many hours, not enough pay, plus you don't have the resources or the material. On top of that, the government found a way to solve the shortage, which is basically bring people from outside, what they call tarefeiros, and paying them an obscene amount compared to their peers that are there studying, doing the work. These folks, I mean, they have no fault, right? They are there to be hired. They are hired and they come in and they make double of what the doctor that is in there studying to become a specialist is making. So that's absolutely infuriating. And you can see here in this news, I think they were able to get an email of someone making an offer. And you basically see here, it says, dear, I hope you find yourself well. We are looking for an obstetrician here in the hospital of Caldas da Rainha, well, Silver Coast in this case. And we are looking for these spots. Would you be willing to do it for 95 euros an hour? I mean, how do you think the doctors that are there feel when this stuff is happening? Because I also have their prices, how much they earn. So because this is all public, right? They are public servants, so you can see how much they make per hour. And let's look at the lower scale. So let's look at someone that is still doing the specialization. So they finish the 7 years to be a doctor, but they are studying to be an obstetrician or a psychiatrist, and they are kind of on the bottom of the scale. So this is 15 euros. Well, this is a little old. Let me see if I can find. Okay, I think this is a more accurate one, but still, let's look at the very bottom here. Someone that just finished the base core training and now they're doing the specialization, and they're doing basically 19 euros an hour. 19 euros an hour. And then their peer comes in doing basically the same work in obstetrician and is making 95. I mean, you feel for the doctors, right? I mean, how would you handle the situation? You'd probably be really, really upset. So the last news I wanted to walk through you is regarding the comments from the president of the Ordem dos Médicos, so basically the one that certifies and kind of looks after all the doctors across Portugal. They keep saying one thing, which is more vacancies in medicine is not gonna solve the public system situation. And there, I kind of agree, but I also disagree. Okay, it's not gonna solve the core issue, which is if the environment is not good, if the doctors don't have the material, the equipment, and the support to work, it's always gonna be very challenging. If I think about going to a doctor in US, before you see a doctor, you see at least 3 people, the administration person, you see the nurse, you see a nurse practitioner, and then you see the doctor. So you can imagine that the doctor, his time is really appreciated and he only goes at the right time. Here in Portugal, if you go to the doctor, you immediately get the doctor on the immediate session, and he's doing administrative work. Many times he's doing nurse stuff. I mean, there's also a huge management problem. I feel like the SNS is not properly managed. Am I saying it's easy? Definitely not, but they are able to make it work on the private system. So maybe putting someone there in charge that's well paid, so it's motivated to be there and to do a good job, might solve it. Now, on the other end, I also don't agree with this thing of more openings for people to study medicine is not going to solve the problem. I do believe it's going to help to solve the problem because anyways, it takes 15 years to graduate as a specialist. So why not increase the pipeline so you get more people down the pipeline, and in parallel, you're also making the SSN a better environment so doctors want to stay. So you can do both. I don't like this finger pointing they do a lot between the government and the Ordem of Medics. Just work together and make it happen. So to kind of wrap here, conclusion is, okay, this is in Portugal. Is Portugal the worst? What's going on around Europe? So I searched and I was able to find a report about waiting times across Europe, and Portugal is not the only one. This is happening across other European countries. Okay, yeah, Portugal is leaning towards the top, but you also have Norway. You would think Norway, Nordic country, would have their problems sorted. Well, you still need to wait for like a catheter surgery. You still need to wait for a hip replacement. You have it here again. So Portugal is not the worst offender. Other European countries have the same type of challenges of not having enough resources to handle their patients. So I hope you enjoyed this video. As I've explained on the very beginning, this is not a trivial issue because there's two parties, government and Ordem dos Médicos, that don't fully work together towards a common objective, in my humble opinion. Again, this is all my opinion. It's based on what I've read and feedback from friends that are studied in Portugal to be doctors and are actually doctors, some that stayed, some that left, and they've called out some of these situations. So there is a lot of opportunity to be better. I have huge appreciation for the doctors that are in the public system because I know with the conditions they're working and they're trying to do their absolute best. I had a small procedure done, surgical procedure done in the public system, and I'm extremely thankful. It's unbelievable. I was super well treated. They even did a little essential oils and a little massage because I was gonna get a big injection and some points. There is a lot of amazing people in the system, but if the system is polluted, it pushes them too far, it does not pay enough, this is bound to happen. But it does not mean that the public system is bad. It's actually pretty good.